In the world of metabolic science, it feels like the pace of innovation is just relentless. Right when you think we've hit the peak, something new and even more powerful comes along. And as we're looking ahead to 2025, there is one compound that is generating an absolutely massive amount of buzz, a peptide called Retatrutide. That is the big question, isn't it? So today, that's what we're diving into. Is this thing a true groundbreaking tool for mastering your metabolic health? Something that goes way beyond the number on a scale? Or is it just the next souped-up version of the weight loss drugs we already know? Let's get into it. Okay, so here's how we're going to break it all down. First up, we'll cover what retatrutide even is. Then we'll unpack its secret weapon, what we're calling the triple agonist advantage. From there, we'll explore the incredible research-backed benefits, put a spotlight on the actual research compound itself, and then wrap things up with a really important discussion on safety and what's next. All right, let's jump right in. What exactly is this molecule that has the entire research and longevity community buzzing with excitement? Okay, so at its heart, retatrutide is something called a triple agonist. Now, think of an agonist as a key that fits into a specific lock in your body to trigger an action. While older peptides were like a key for one, maybe two locks, retatrutide is basically a master key. It unlocks three crucial hormone receptors all at once: GLP-1, GIP, and glucagon. This triple action approach is exactly what makes it such a potential game changer. And that master key advantage is a huge deal. I mean, to really wrap your head around its power, you've got to compare it to the peptides that came before it, the ones you've probably heard of, like semaglutide. Yeah, you can literally see the evolution right here on the screen. We started with single agonists like semaglutide, targeting just that one GLP-1 receptor. Then we got dual agonists like tirzepatide, which added GIP to the mix. Retatrutide is the next leap forward, adding that third target, the glucagon receptor, and that's the secret sauce. Activating the glucagon pathway is like pouring gasoline on your body's metabolic furnace, just cranking up your energy expenditure and fat-burning capabilities. And the results you get when you pour that gasoline on the fire are, well, they're honestly staggering. This number you're looking at, 24.2%, that represents the peak average body weight reduction they saw in clinical trials. That's a figure that would have sounded like pure science fiction just a few years ago. And here's the data behind that incredible number. If you just look at this chart, the trend is crystal clear. The higher the dose of retatrutide, the more significant the weight loss, bottoming out at that unbelievable 24.2% drop after 48 weeks. Now, just compare that to the placebo line, way up at the top. It's practically a flat line. The data speaks for itself. It's just undeniable proof of how potent this is. But like we said at the beginning, this story is about so much more than just a number on the scale. The research is pointing to this whole cascade of positive effects that really add up to a holistic, total system upgrade for your metabolic health. So let's break down those primary benefits. First, and this is the holy grail for body recomposition, it triggers massive fat loss while helping you preserve your precious lean muscle mass. Second, it delivers a really potent and sustained appetite suppression. And third, thanks to that glucagon furnace effect we keep talking about, it literally increases your body's energy expenditure and fat oxidation. It's a true trifecta for changing your body's composition. And the benefits go even deeper, affecting your entire system. We're talking about major improvements in insulin sensitivity, which is just foundational to good metabolic health. We're also seeing significant reductions in blood pressure and positive shifts in blood lipid profiles. This all suggests that retatrutide isn't just a weight management tool, it's a potential powerhouse for long-term wellness and longevity. Okay, so with results this promising, it's absolutely no surprise that researchers are eager to study this compound more. So for the next couple of slides, let's shift gears and spotlight what a research-grade version of this peptide actually looks like. We'll focus on the retatrutide 15 milligrams from Peptide the Source to get a sense of how it's being used in scientific settings. Right, because for any scientific study to be valid, the quality has to be top-notch. It comes as a lyophilized powder, which is just a fancy way of saying freeze-dried, and that keeps the molecules stable. But what's really crucial here is the purity, over 99%, and the fact that it's verified by a third-party lab. For researchers, those are the non-negotiable gold standards. And that 15 milligram vial size gives researchers the flexibility they need for precise dosing. A typical research protocol might start with a very small weekly dose, say 1 to 4 milligrams, and then they'll carefully titrate, which just means gradually increase the dose over time.
This lets them observe the effects at different levels and dial in the optimal protocol for their study.
And that brings us to what is, without a doubt, the single most important point we need to make today. For research use only. This is not just fine print, folks. It's a critical disclaimer that defines the entire landscape for this compound right now.
That's exactly right. This last section is our essential reality check. It's one thing to get excited about the potential, and believe me, we are, but it's absolutely paramount to understand the current status and the safety profile. So let's be crystal clear here. Retatrutide is still in the middle of late-stage phase 3 clinical trials. It has not been approved by the FDA or any other regulatory body for human consumption. Its availability at this time is strictly, and we mean strictly, for laboratory research purposes only. So who is actually doing this research right now? Well, it's really a community of pioneers. We're talking about advanced scientists who study body composition, longevity enthusiasts, and biohackers pushing the boundaries of human potential, and even some elite athletes who are looking for every possible edge. These are the groups on the front lines, exploring its capabilities.
And all of this leaves us with a final, really crucial question. Science is handing us these tools that are more powerful than anything we've ever had before. So the challenge for all of us, for researchers, for enthusiasts, for everyone, is how do we responsibly navigate that frontier between the incredible potential and the very real peril of misuse? It's about making sure that our excitement is always, always guided by responsible, rigorous science. If this deep dive got you curious and you want to learn more about the science of research peptides, a fantastic place to continue your exploration is Peptide: The Source.